We're very happy today to have Dr. Carrie Nieman, MD, MPH, Master of Public Health. She's a clinician and a researcher with a focus on age-related hearing loss and eliminating hearing care disparities among older adults. She is an associate professor in the Department of Otolaryngology, head and neck surgery at Johns Hopkins, and she's core faculty at the Johns Hopkins Cochlear Center for Hearing and Public Health. Funded by the National Institutes of Health and the National Academy of Medicine, her work seeks to extend access to hearing care for older adults through evidence-driven community-delivered models. Her clinical practice through Hopkins is based in Bethesda and East Baltimore. And if we're ready, Dr. Nieman. Dr. Nieman, where did you get your medical degree?
Great question. I have a slide that goes over some of those things, but we can get started with that. So I am most recently from the Chicagoland area before I moved to the area here. So I did my undergraduate at Northwestern and then stayed in the area in Chicago at the University of Illinois at Chicago and did my MD and Master's of Public Health there. And then came to Hopkins for residency in ENT or otolaryngology head and neck surgery. I did some additional time during residency for research and then did some additional training for just ear-related or otologic surgery in Switzerland, and then stayed on faculty at Hopkins. So I'm getting this signal from Joe that I think we're good to go, but thank you. Wonderful. Thank you all for inviting me to come and talk. I'm really excited to share some of the work that we have been up to in terms of thinking about hearing loss and why it matters and what can we do about it. So I will be talking about over-the-counter hearing aids and getting to the question, are they right for you? But first we'll spend a little bit of time kind of giving a little bit more context of why hearing loss matters, particularly from kind of a bigger picture perspective. So we'll definitely get to answering that question and have some time to go through your own questions as well. But we're going to spend a bit time on some background. So I don't have any industry-related disclosures. I do sit on the Hearing Loss Association of America's board, which is a nonprofit that represents everyone in the United States with hearing loss, and a great organization, and I'll reference some of their materials as well. We already kind of touched on this, so that's a little bit of my background. So when I talk about a public health approach, I'm really talking about kind of this big picture question at a population level is what we'll be spending some of the first part of the talk on. And in that introduction, you heard that I'm core faculty at the Cochlear Center for Hearing and Public Health. And so that is a research center within the Bloomberg School of Public Health that's very much focused on age-related hearing loss from that big picture perspective. So it is a really unique center in that we have a whole bunch of different disciplines and perspectives represented. So individuals like myself who are ear surgeons, as well as audiologists who, as we all know, are hearing care experts, and then epidemiologists, health services researchers, who all kind of come together to think about hearing loss from a bunch of different perspectives. And the center is led by Dr. Frank Lin. If anybody has, yes? Sure, I will try to do that. Yep. So Dr. Frank Lin is the head of the center, and somebody, if you have been following age-related hearing loss, over-the-counter hearing aid device discussions in the media, is somebody who is frequently cited. So I'll be sharing a little bit of his work as well. So from a public health perspective, we have the questions of how many people have hearing loss, how many people use hearing aids, does hearing loss matter, does addressing hearing loss matter from that big picture perspective? And if we think it matters, how in the world are we going to get hearing care to as many people as possible? So those are the types of questions we think about at a public health perspective. From a medicine perspective, right, when you go to the doctor, that's very much one-on-one. So that's about how can I deliver the best care and the best outcomes to the person that I'm seeing, in front of me. So there's a little bit of tension when we talk about some of these big picture approaches versus kind of the one-on-one approaches. So we'll kind of get into that a little bit, but we're first going to start public health, and then we're going to talk more about kind of that one-on-one care in a clinic setting. So first we'll start about what is hearing loss, at least just at the very, very basics of it. So hearing is really all about kind of getting messages into the brain and then kind of decoding that and understanding that. So we have sound waves that enter the ear, they go into the inner ear. The inner ear then needs to send those signals to the brain. The brain then needs to process that signal and be able, yep, I heard that, I understand that. So it's a couple of different steps. What can change that process, particularly kind of at that inner ear level, are a number of different things. We know genetics, family history plays a role. We certainly know that noise exposure can play a role. But the biggest factor is really aging. Aging is the biggest risk factor for hearing loss. And when we think about age-related hearing loss, we say yes, aging is probably the most important factor, but in reality, it is likely a number of different factors that all combine that we don't have 100% handle of what is the biggest underlying factor. But generally, we're talking about age. And so with age, what can happen is that those sound waves or those signals, when they enter the inner ear, they are no longer able to send as clear a signal from the inner ear to the brain. The brain then is trying to process this garbled signal, and sometimes we have to guess or don't quite get what we're hearing or understanding because of those fundamental changes that are happening in the inner ear for all those factors, right? Genetics, noise, age. So that's kind of the basics of hearing loss, particularly age-related hearing loss. I know, really high level. So in the past, really 10 years or so, we have really been focusing on, particularly at the center, of why does hearing loss matter as we get older? So we know that hearing loss is really common. if we look at nationally representative data from the United States, and we look at everybody who's 70 years or older, 2/3 have a clinically significant hearing loss. If we look at everybody who's 80 years or older, over 80% have a clinically significant hearing loss. So it is almost all of us at some point in time are going to have changes in our hearing. And so in the past, we have kind of said, it's hearing loss, it's really common, but it may not really matter as we get older. Yeah, it's frustrating, for sure. It's frustrating potentially for our family, our friends, but we really just kind of thought of it as this just benign part of the aging process. But that has really changed in the past decade or so. And that has a lot to do with a lot of the work that has been done trying to understand, is there some association with hearing loss and other parts of the aging process? So in terms of in the past 10 plus years, we have found that age-related hearing loss is independently associated with negative outcomes in almost every aspect of aging. So hearing loss has been associated with accelerated cognitive decline, with dementia, with falls, with increased hospitalization, increased morbidity, increased mortality, while obviously we're controlling for a lot of other factors in these kind of large studies of populations. We see these associations, and we see these associations pretty consistently. So it makes us really now start to think about hearing loss in a different light. Hearing loss may be something that is very important for us to be addressing as just one of the many things for us to be thinking about in order to age as well as possible, in terms of how can we really make sure we're getting towards that healthy aging perspective. Hearing loss is one of the many things we need to be thinking about. This is a really important diagram from 2017. I know it's very small. This diagram comes from the Lancet Commission, which is a large kind of medical clinical research body. And one of the things that they focused on, the Lancet, they look at many different issues, but they were commissioned to look at dementia and to look at all of the literature that has been kind of associated with dementia in terms of risk factors over the lifetime. And so in 2017, for the very first time, there was enough literature or enough research that had been done looking at hearing loss and its potential association with dementia, that when they did this report back in 2017, hearing loss was for the first time included in when we were look kind of over the life course of all the things that have been associated with dementia. And because of just how common hearing loss is and how strong that association has been between hearing loss and dementia, they found that hearing loss at a population level, not individual, but at a population level, was the largest potentially modifiable risk factor for dementia over the life course. And that is based on those studies, again, associations, not talking about causation, but association. Mild hearing loss has been associated with the 2 times increased risk of dementia, a moderate hearing loss, a 3 times increased risk, and a severe hearing loss, a 5 times increased risk in dementia. And those numbers are pretty consistent over different population studies. So it raises the question of, can we do something about it in terms of if we give people hearing aids, can we slow cognitive decline? So that's kind of the question that has been front and center for many of us working in this field. we think that there may be a couple different ways that hearing loss may be associated with cognition. One, it may be that you have this garbled signal coming into the brain, that the brain then is dedicating more resources to kind of processing that garbled signal, that it's then taking resources away from other processing. That may be one potential way it's associated. Another way is that there may be structural changes that are happening in the brain because of the hearing loss that then lead to other changes in terms of cognition. And then we also know, right, that there's association between hearing loss and social isolation. And that social isolation alone, regardless of if it's because of hearing loss or other factors, social isolation alone is a risk factor for dementia. Or is it some common underlying pathway? Those are some of the ways we think there may be a connection between these two. But the thing that is, really important is if we address hearing loss, maybe we see changes in those different things. And so there, I know, are many reports in the media. You may have heard this from your audiologist in terms of, get hearing aids to slow cognitive decline. But you have to be very careful in interpreting that information because there is no kind of big study that has yet been done of saying if we do it in a strong kind of scientific fashion, if we give, randomly half the people, who have some hearing loss but no memory problems versus another group who have, again, hearing loss and no memory problems, if we give half hearing aids and half no hearing aids and we follow them out, do we see changes in terms of slowing and cognitive decline? That study right now is what's called the ACHIEVE trial. So this is the first study of its kind that we hope will help us answer that big question of whether or not using hearing aids can slow cognitive decline. The results for the ACHIEVE trial, so it's been ongoing for a number of years now, and these results are expected this summer. So we're really excited to just see what we find. But before then, anything you're seeing now, a lot is based on association and not necessarily a trial with really strong scientific rigor. So we're all anxiously awaiting for this, but I wanted to at least spend a little time talking about this in terms of what you may be reading and hearing in the media. So how do we manage age-related hearing loss? So there's two factors, right? So we know there's these changes in the inner ear that are happening. And so oftentimes we manage it with something called sensory management, which is basically how can we help people get access to sound better. And then we also, in terms of what's called oral rehabilitation, kind of the clinical medical term for basically how can we live well with hearing loss, because we know no matter what device we're talking about in terms of improving access to sound, it's never perfect. So there's always going to be some need for things like communication strategies and understanding the limits of technology. And so that's what that is part of it. The sensory management side of things of how do we get better access to sound, there's really two main ways we do that, right? Hearing aids and cochlear implants. Cochlear implants are for individuals who are no longer benefiting from hearing aids and have a more kind of severe, profound hearing loss. A cochlear implant can be really important and really powerful. But at a population level, the vast majority of people who have hearing loss are in the mild to moderate range and can benefit from hearing aids. So what do we know about hearing care among older adults? We know hearing loss is really common, but we know that few people actually use hearing aids. So if we look at everybody in the United States who's 70 years or older, again, we know that 2/3 have a clinically significant hearing loss, and it's only around 20% of those individuals who have a hearing loss actually use hearing aids. We know that there's a lot of reasons that go into that. But if we're thinking again about hearing loss as this important part of healthy aging, that really then needs to shift our thinking about hearing care. Yeah, as an ENT doctor, yes, I care obviously about communication, but I think what's really important is that we're thinking now about hearing care or access to hearing care as this potentially essential tool for aging well, right? We want to make sure everybody can see. We want to make sure that everybody can hear. If we are going to make sure that everybody has access to what they need to age as well as possible. So if that's the case, then, those low numbers of how many people use hearing aids are pretty unacceptable. And then differences in care that we see in terms of hearing aid use are also pretty unacceptable. If we look at a nationally represented population in terms of in the US, we see by race, ethnicity, we see that hearing screening really doesn't differ that much. Usually hearing screening is something that's covered by insurance, and we don't see many differences by race and ethnicity. But unfortunately, in terms of what we see kind of across health and healthcare, we see some of the same disparities in terms of only around 10% of African American older adults who have hearing loss and older Mexican American older adults who have hearing loss actually use hearing aids. Again, there's a lot of reasons that go into kind of low hearing aid use. But in terms of just understanding the numbers, we certainly see disparities just like in other fields. We also can look at other studies that are not nationally representative, but provide us with some more information. And so this is a different cohort where we have data on individuals' hearing status and also some other measures of socioeconomic status. And so we can see differences, again, by race, ethnicity. We're around 10% of African American older adults with hearing loss, again, use hearing aids versus a higher number of white older adults. We see differences by education, and we see differences in terms of by total assets. So if we're seeing some of these disparities and we're seeing these differences in care as well as just low rates of hearing aid use overall, how do we expand access and use to hearing care? This has been a topic of focus for a number of years now. These are two really important reports that have come out just in the past number of years. In 2015, there was the President's Council of Advisors on Science and Technology, and they looked at what are some barriers to hearing aid use. And one of them that they identified was just how restrictive and how difficult it is to get hearing aids. And so that was the first time that over-the-counter hearing aids kind of were proposed. That was then quickly followed in 2016, the National Academies of Medicine did a year-long kind of focus and committee on trying to understand how can we improve access and affordability to hearing care for adults. They came up with many different recommendations. They echoed the recommendation to move towards over-the-counter hearing aids to improve access. But they also recommended things like we need new and different models of care to reach more people. That is not just seeing an ENT or an audiologist, but how can we work with other types of professionals or paraprofessionals to get people access to care? And so we'll talk a little bit about that as well. That was 2016 that the report came out. 2017, so kind of 1 year later, like record speed, bipartisan federal legislation was passed to allow for the creation of over-the-counter hearing aids. That's a huge success story in terms of federal legislation. That's Dr. Lynn, the director of our center, testifying in front of Congress in support of that legislation. And that legislation is something that many of our team members have been very involved in terms of the crafting of the regulations throughout these past years. The goal from a population perspective is to say, if we have over-the-counter hearing aids, our hope in the end is that it will drive down cost for hearing aids. It will hopefully improve quality, hopefully be responsive to user needs, since you're going directly to consumers and not necessarily a middleman of the ENT or the audiologist always, and that it hopefully opens the doors for new models of care. That's kind of the big picture perspective that we're hoping. But again, that may look a little different, right, when we're talking about kind of the individual patient, but those are the big picture goals of over-the-counter hearing aids. And so a lot of the work that I do then is thinking about, we have over-the-counter devices, how can we get them to more people? And that is thinking about how can we help people without necessarily having to come to an ENT or audiologist and all those hoops in order to get access to hearing care. How can we reduce barriers? So community delivered hearing care is thinking about how can we deliver care outside of the clinic with partnering with individuals like community health workers, peer mentors, where ENTs and audiologists may move more into a supervisory role. ENTs, audiologists, we will always be there in terms of serving patients, but if we want to potentially extend our reach further, we can also work and partner with other individuals and to think about how can we do this with new technologies. So our work within HEARS is really a program that we have designed over the years to help think through a different model. It is not meant to be a replacement, but to say, how can we help deliver hearing care and remove as many barriers as possible for some individuals? And so the HEARS program is a 2-hour kind of structured program that is designed to be delivered by a community health worker. So not an ENT or an audiologist. In those 2 hours, they go over kind of what does it mean to have hearing loss. They go through a step-by-step fitting and orientation to an over-the-counter device. And then they go through some education and counseling on how to live well with hearing loss. So again, 2 hours, all done within a community setting, not in a clinic. These are just some of the examples of some of the materials and how they look like in terms of how we talk about hearing loss. It's designed for a 6th to 7th grade reading level and is meant to be, as easy as possible. These are some of the step-by-step of how we kind of go through how to fit. So we've trained about 8-9 older adult peer mentors in Baltimore City to deliver this structured 2-hour program. And this program, so these are some of the peer mentors kind of working together. Here are some of the peer mentors. And they worked at 13 different sites around Baltimore City. And they delivered the hearing care intervention to a number of individuals. And we did kind of that randomized control trial. Kind of the Achieve trial is a randomized control trial where we take half the people and they get randomized to kind of receive one intervention, the other receive another. So kind of that premise. For us, what we did was we recruited about 151 individuals with hearing loss, and primarily low-income older adults in Baltimore City. We did this in partnership with affordable housing in the Baltimore area, as well as senior centers in the Baltimore area. So for individuals who have some hearing loss, can they go through this 2-hour program, and what kind of benefit do they have or not? So we're excited to share the results that came out just in December of this year, and so we'll kind of walk through this a little bit. So those 8 peer mentors, they were the ones who delivered this intervention, this program throughout the trial. So individuals were 60 years or older. You can see we had 151 individuals. There were a little bit more women than men. They're around 77 years old, and those were those 13 sites around Baltimore. And so those 151, half got the program right away, and half had to wait 3 months until they got the program. So everybody got the program in the end, but we did have people kind of wait so that we could be able to compare what happened if we didn't do anything versus doing something, so that we could have a little bit of a control group to understand. And our main focus was communication function. Did people feel like they could communicate better? And so I know these numbers are small, but what we're seeing here is the important number is that we saw about a 13-point improvement in this communication function scale. And I know that doesn't mean too much in terms of that 13 points, but what it is important is to look then in the literature, kind of at other studies that have used gold standard hearing aids fit by an audiologist. That's a similar improvement in communication that we're seeing with a 2-hour program using over-the-counter devices delivered by a community health worker completely outside of a clinic. So trying to say, yes, it is possible for us to think about safe and high quality ways to provide access to more care. By no means is the ENT or audiologist going away, but how can we get more reach, right? So that's what we sound here. So what does that mean in terms of, at least it gives us a bit of a signal that low cost hearing technology seems to work, particularly if you can get some help and assistance in using that technology. And that working in a community-based setting in terms of people who traditionally have not been worked with in terms of delivering hearing care, in terms of hearing care workforce, is a promising approach that may help reach more people and help just one part in closing some of those gaps that we see. So that is some of the background in terms of that big picture population public health perspective. So now I'm going to switch and say, okay, now it's more my doctor hat and not my public health researcher hat. So that's all well and good, right, at the big picture level. But what about over-the-counter hearing aids for me? Is this something that we can think about? Is this an option? So we'll spend a little bit of time now talking about over-the-counter hearing aids. So they are designed for people who are not having any other types of ear concerns or issues. So for example, if you have any issues with drainage from your ears, we're not just talking about wax, but kind of pus, things like that coming from your ear. If you're having ongoing ear pain or discomfort, if you're having issues with dizziness that are really persistent, and definitely if you've had a sudden change in hearing loss or there's a big difference in the hearing between the two ears, these are all very much reasons that you would still go see, an ear, nose, and throat doctor. But these overall, right, at a population level are pretty rare, especially here in the United States. Over-the-counter hearing aids are also specifically designed for adults. They are not designed for children, right? They're designed for individuals who are 18 years or older, people who generally have, about the same hearing in both ears, that has been a gradual change in hearing. And there's two types of hearing loss. Hearing loss that can come from things like a hole in the eardrum or fluid behind the eardrum, versus that inner ear kind of changes that we talked about at the very beginning. Again, the vast majority of hearing loss at that big picture population level is exactly this. Hearing loss that's about the same in both ears, that's gradual, that's nerve related. That in terms of is describing age-related hearing loss. Over-the-counter hearing aids are designed for individuals with mild to moderate hearing loss. So not everybody by any means in terms of people who have more severe degrees of hearing loss. But you see there's a little tiny asterisk there. The big difference is that what is written in the regulations is that it is a perceived mild to moderate hearing loss. It does not have to be that you have proven by a hearing test mild to moderate hearing loss objectively, but that if you perceive yourself to have a mild to moderate hearing loss, this is something that would potentially be of benefit for you. How do we think about, is it a mild to moderate hearing loss? A couple things, right, to keep in mind. Oftentimes you may be thinking that you have some trouble understanding conversations when there's background noise. That's something that we start to experience even with a mild amount of hearing loss. And maybe one of the ways we first start to notice some hearing changes is that you kind of struggle in a restaurant or kind of social gatherings, family gatherings, where you're struggling a little bit if there's some background noise. You may have a little bit of difficulty on the phone, but usually you do pretty well on the phone. And one-on-one, you do pretty well. You may find that you have to turn up the volume of the TV or the radio. And I'd say one of the biggest things are these two last ones of feeling like, yeah, everybody is really mumbling, and it's you and not me. And that, I'd say, is some of the biggest things, even at a mild to moderate hearing loss. And then the feeling of I can hear you, but I can't always quite understand you. Those are some of the ways that are even a mild to moderate hearing loss kind of first start to show up. And it's really gradual, right? So we don't always notice, and we're not always kind of thinking in terms of, it's my hearing. But those are some ways to kind of think about it. So now we're going to get into a little bit of some of the technicalities of over-the-counter hearing aids with the goal of, if this is something that you want to navigate or at least understand some of the limitations potentially right now, if this is something you want to navigate. Over-the-counter hearing aids is a new FDA category as of October 2022. It is designed to be regulated by the FDA to ensure some amount of safety and quality. There has been a category of something called personal sound amplification products. That's what we have used in the past in some of our early work. And those have been products that have been available for 30 plus years. They have not been regulated by the FDA. So there's a wide range of quality. Some of the devices are very, very good and are just like hearing aids in terms of some of the devices that we have tested, but not all devices. And so it makes it a little bit of the Wild West in terms of trying to understand what's good versus what's bad. And so that's what the goal of the over-the-counter hearing aids has been, is to try to set some standards of quality so it's not so much of the Wild West. So in terms of understanding the OTC hearing aids, there's a couple different levels. So the first type of over-the-counter hearing aid just has to be registered with the FDA. The FDA says, here are the list of things that this device needs to be able to do in terms of its sound quality, in terms of the limit of the volume that it has. These are the things that it needs to fulfill. And people then can self-report and register, yes, my device does that. Or it doesn't even have to actually be that the device is actually in production. It's just their thought of a device. They can register it, and that you can see there's a website there if you put in the product code, and there's around 30 or so of those devices now. There's another website here called hearingtracker.com that also has a list of some of the over-the-counter hearing aids that are kind of being updated regularly. That's in contrast to the personal sound amplifying products that are not registered, but they may or may not be labeled as over-the-counter, so it can get cloudy pretty quickly. But as you notice, it's just registered. So kind of the first pass is some of these devices just say, yep, we do these standards, but there's no independent verification necessarily of whether or not they fit that. What there is then is a special category within that bigger category of over-the-counter hearing aids of something called self-fit over-the-counter hearing aids. Self-fit over-the-counter hearing aids are the devices that do go through a rigorous process that need to be checked by the FDA in terms of safety and quality. So those are things that we can then see in terms of just registered versus registered and reviewed. Those self-fit, like I said, go through that rigorous process. And that's the link there, the same in terms of looking at the FDA. You use a different product code to look at those. And those are only a couple that have been through that full process. So the moral of all of that is if you are thinking about an over-the-counter hearing aid, what I would recommend that you're looking for in particular is that self-fit over-the-counter hearing aids. Because that really is kind of the highest quality. That's what we were all kind of hoping. And the benefit of that is that it can be very much tailored to your individual level of hearing loss, and that we're getting that kind of independent verification of the quality and safety of the devices. So that's the goal of all that kind of discussion. There are a number of different ways where you can find over-the-counter devices. I would say the main way to purchase them is online. Amazon, just Googling, there are obviously a whole lot. And I think for right now, as just this is a very new category, I think things are probably more confusing than ever. I know we're all hopeful and anxiously awaiting for things to kind of help clarify themselves a little bit more. But right now it is a little bit challenging for sure. So you can get them online. You can get them at pharmacies like CVS or Walgreens. You can get them at places like Costco. Even some audiologists and ENTs are now including over-the-counter devices in the lineup of devices that they may be talking about with you if you go and see them. So some of the things to think about if you're like, yeah, I don't know, this sounds a little bit daunting. So what are some of the considerations? One is, how much do you want to know about your hearing loss? You know, for some people, you know, again, to get an over-the-counter device, you don't ever need to see anybody. You can say, yeah, I feel like I'm having some changes, so let me go ahead and just try a device and see how it goes. If you're the kind of person who's like, yeah, no, I really want to objectively know, one, do I have hearing loss and how significant is that hearing loss? Then for sure, proceeding with a hearing test, like with an audiologist or an ENT, is the right way to go. Generally, hearing testing is something that's covered by insurance, whereas generally hearing aids are not. There's a lot of nuance to how hearing aids are covered, but they are not covered by Medicare. There's obviously been a lot of push in the past couple of years to get them covered by Medicare, but for right now, not. A lot of Medicare Advantage programs provide some supplement and things like that, but generally it is something that you'll have to pay most of it out of pocket. How much do you want to navigate this on your own in terms of whether you doing the Googling, whether a family member or friend are helping you kind of navigate what's online or at the pharmacy? And then thinking through a lot of these devices, especially the self-fit devices, generally work via Bluetooth with a smartphone. So kind of thinking about how do you pair a device via Bluetooth to your smartphone? How do you download the app and use the app to kind of navigate the settings of the device? And so is that something that you feel pretty comfortable with, or is that something that you may have some family or friends that can help you out a little bit? And again, how comfortable are you with the technology like smartphones, Bluetooth, things like that? And we all know that everybody has a little bit different level of comfort with all those different steps. But a lot of that are things that over-the-counter hearing aids currently rely upon. And because of that complexity is in part a lot of the reason why we do some of that work that I talked about earlier in terms of hears, of having somebody kind of help you walk through some of these devices so that it's not so daunting to think about how to use a Bluetooth device or smartphone. So if you are going to go down the route of an over-the-counter hearing aid, some of the things to keep in mind is, do you need a smartphone or a computer in order to set it up? For most of them, you do. And how about to adjust settings on an ongoing basis? Do you always have to connect to your smartphone to be able to adjust it? Is it self-fit, like we talked about? You'll often need to download an app, connect via Bluetooth. What in particular is the trial period? And what is the return policy? That I would definitely have a good understanding of. Is it rechargeable or does it use batteries? And I would always recommend, thinking about rechargeable, but because of the ongoing kind of costs and things of battery, but they're both good options. Then there's other kind of nuances in terms of things like something called a telecoil or a loop system. So sometimes in some places like large churches or synagogues or theaters have a special system in place that hearing aids can connect to directly to get access to the microphone and amplification system. So some of the over-the-counter devices, do they have that system or not? Some hearing aids, and most hearing aids, have that system, for example. And can you use it kind of like as a Bluetooth headset in terms of talking on the phone, streaming music, things like that, if those are things that are important to you. Different other things to think about are things like directional microphones, of how does it help kind of put away background noise versus emphasize what you want to hear. In terms of remote microphones, does it have something to help in a restaurant setting where you can give a microphone to somebody in a busy setting and they can speak to it, and that goes directly to your hearing aid? That telecoil was what we just talked about. How easy is it to actually use the buttons in terms of, are they really tiny? Can you feel them when you're on your ear? What are the charging options? What are kind of the ways in which you learn how to use the device? So those are some of the things to keep in mind. There are a lot of devices, and I'm by no means going to list all of them. These are just some of the ones that I've worked with in the past. So Soundboard Solutions has a number of great options. They fall in the category of personal sound amplifying products. So they've been on the market for a number of years now. They are not over-the-counter hearing aids. I think they're seeking that recognition, but for right now, they are, you can see the cost there. It's about $350 or $450 for one device. They look like traditional hearing aids in many ways, or a Bluetooth headset. We've tested these and they function really just as well in terms of sound quality as gold standard hearing aids. So these are what a lot we use in our trials in the community setting. Here are some of the over-the-counter hearing aids you may have seen. So the Jabra Enhance or the Bose Lexi, and you can see I think the entry point for a lot of the over-the-counter devices right now seem to be around $800, and that's for 2 devices. I don't want to ever forget really just large and simple devices. So these are really good options for individuals who may have some dexterity issues, so bad arthritis or have had a stroke. And really are the most affordable of the options. I know they don't look necessarily very sexy in terms of little tiny hearing aids, but when affordability is a big concern or other issues like memory changes and things like that, these can be really good, easy, simple options to keep in mind. And so we use these devices as well in our work. I will just leave with a couple things in terms of, I mentioned the Hearing Loss Association of America. They have a little bit of a checklist to think through about over-the-counter hearing aids. And then I mentioned that hearingtracker.com of kind of an ongoing running list of over-the-counter hearing aids. We are at a really exciting time in hearing care. We talked about kind of the different changes in 2021. I do a lot of work with the WHO, came out with the World Report on Hearing for the first time in terms of thinking about how can we really make sure we're getting access to hearing care for more people, both nationally and globally. And so it is a big time of change in hearing care, but it's definitely in my mind something that's overdue, and we're really excited. I think, yes, it's going to be a little bit bumpy. I will say many countries are looking to us and the over-the-counter hearing aid regulation to see how it goes, what lessons are learned. I'm hopeful, though, in the end that we will get to a point where hearing care is more accessible and affordable. Because at the end of the day, right, this is what it's all about, to make sure that all of us have access to what we need to age well. So with that, I'll open up to any questions. Thank you.
Simple question. Will we be able to have access to these materials?
Yes, Joe, I think, has a presentation. So hopefully Joe will be able to share it at some point. But
Yeah, I plan to upload it to the, or have one of the IT committee members upload to the Fox Hill RCA, it's the website for the owners, so we have one. Yeah. Did anyone else have a question?
Could you summarize for us what the advantages of going to an audiologist or an ENT versus going OTC?
Yeah, great. So, if you had asked me before over-the-counter hearing aids came out, I would say the affordability was the biggest thing. I know myself and many people are very disappointed at how expensive the over-the-counter hearing aids are debuting at. So, for example, over-the-counter hearings that you saw were about $800 or so. I regularly talk about Costco to my patients, and I will say Costco runs maybe around $1,200, $1,400 for hearing aids, is some of the prices I've heard, but I know it can be a range. And so if the cost is not that different from going to some place where you can get a little bit of extra help, but I'm hoping that in the future those prices will come down. But what else can you get from seeing an audiologist or an ENT? A lot comes down to how much do you want to know, like we talked about. So seeing an audiologist, they'll do kind of a brief history. They'll do a test so that you can objectively just see where you're at. They'll be able to tell you what type of hearing loss it is in terms of, does it look like age-related or there's other things going on? And then from there, if you are thinking about going, further and saying, yeah, I think I'm ready for hearing aids, they then really can go through kind of that step-by-step process with you of thinking about where is it that you're struggling most and help you guide through, okay, what are some of the bells and whistles that you want or need for your lifestyle in terms of like, I go to the theater a lot, or I love to go out to eat, or no, I pretty much, just want to make sure I can hear the TV well, so what is it that is driving you that they should be able to then kind of work with you to think through what is it that you're looking for in the devices, and then go through kind of, okay, let's get you started with the device, let's, get you comfortable with it. It isn't, as anybody who may have been through the hearing aid process, it's not as simple as wearing glasses, right? You put the glasses on and you're like, great, everything is perfect. It takes, I would say, at least a month of regular use of the device, oftentimes, for you to say, okay, yep, I know I'm hearing a lot of things I don't want to hear. I'm hearing background noise. It seems too loud. All of that to get over that hump takes time to get used to it. And those are the types of things that having somebody guide you through that process, I think, is very helpful versus kind of ordering something online, not quite sure how to set it up, and then saying, okay, put in your ear for a couple of days, and you're like, oh my gosh, this is terrible. That would be the outcome that we don't want to happen. So if you are feeling pretty good about your technology level, or in terms of the price point is important for you, I think over-the-counter hearing aids are a very good option. But if you are looking for a little bit more information or a little bit more help in the process, those are the things that you can get from seeing an audiologist or an ENT. Oh, let's maybe wait for the microphone here.
I was just wondering how advanced the cochlear surgery is today. I noticed you had to go to Switzerland to get trained.
You know, yeah, no. We're always looking to get exposed to new techniques and new strategies. So it's cochlear implant surgery is very, very common, and especially for older adults. So that knowledge is definitely not just in Switzerland. Cochlear implant surgery, we know that people do very, very well with cochlear implants if you're the right candidate. It is an outpatient surgery. It is usually around maybe 2 hours or so, or even less sometimes. You go home the same day. The biggest part of cochlear implant is not, I know the surgery sounds daunting for sure, but the biggest part is then learning how to use the implant. And that is then a lot of time spent with the audiologist, and it takes about 6 to 12 months to kind of get there. It is really very much for people who have hearing aids or generally have been a long-time user of hearing aids, but then are no longer getting the same benefit. So for people with mild to moderate hearing loss, definitely not an option. But for people who are really still struggling with hearing aids, and the clarity just is not there with the hearing aids, that's when we start to think about it. It is not something that we say you're too old to do. We regularly do the surgery for people who are 80s, 90s, as long obviously it's safe. But in terms of, that's definitely not a factor that we stop. So cochlear implants are a wonderful advancement in technology and something that generally is underutilized for a number of reasons. Sometimes, audiologists don't always refer on to ENTs or things. So if you are in the situation of feeling like your hearing aids are not helping as much as you would want, it's something you should definitely be talking with your audiologist about, of saying, is this something that is, right for me or not?
I recently heard that there's something called a bypass hearing aid. Can you explain that a little bit?
Is it a bi-cross, maybe?
Bi-cross, yes.
Bi-cross, yeah. So that is a special type of hearing aid for kind of the unique situation where there's a difference in hearing between the two ears. Like most of over-the-counter devices, right, and most people have hearing loss is about the same in both ears, something that we can address with a hearing aid. But for people who, for example, may have had a sudden loss in hearing, or who have something like Meniere's disease, where they have really limited and difficult hearing in one ear, that can no longer benefit from a hearing aid because it's just so garbled, then we think about hearing aids where there's one in each ear, but it helps take the sound from the bad ear and then send it over to the good ear. So you're getting access to the sound from both ears, but it's all going to one side versus two ears. So it's a very specific situation for people who have limited to no hearing in one ear.
I need a lot of maintenance with my hearing aid. The charger doesn't work or doesn't, whatever. Now, on the over-the-counter hearing aids, where would you get that kind of help?
Exactly. That is, I think, the question, and a lot of the reason why I'm doing the work I'm doing, to say, yes, we have this tool that hopefully will help open more doors, but we need, for many people, more support to also come along with that. Some audiologists are embracing over-the-counter hearing aids and will say for a fee that, they will help you, in terms of get the device and learn how to use it. But it is a little bit right now of kind of just open. There, are certain groups that are working to try to help bridge those gaps. As I saw on the first thing, there's a nonprofit that I co-founded way back when we started some of this work that tries to fill that gap particularly for low-income older adults, to make some of these over-the-counter devices more affordable. And then they spend time going through to say, hey, how do you learn how to use this device? So basically some of our research, but kind of in the real world in a nonprofit setting. So I'm hoping more things like that enter the field. But right now, it's a little bit kind of find your own way through it right now as we're kind of learning and seeing where the field goes.
Okay. You mentioned the PSAPs, and I'm wondering how are they different from the over-the-counter, and are they available to the public, and are they of any help?
Yep. So they have been available to the public for 30 plus years now. Some of them are helpful, some of them are not. The biggest difference is they don't have to meet any set regulations. There's no set standards. Whereas over-the-counter hearing aids have set standards that they are supposed to be meeting.
You mentioned one kind that did have to.
Yes. Yeah. So some of them that we've tested, we can say yes. So some of the personal sound amplifier devices have been independently tested in different settings. And then I can say, yes, those ones that we've tested do meet some of those standards. But as a broad category, they don't necessarily have to. So that's why if you're thinking about a personal sound amplifier device, first, you may not know necessarily it technically is that in that category, but try and look in terms of some of those sites like Hearing Tracker or looking at reviews or things to try to understand how people are using the device or not. The safest bet in terms of is seeing for that independent kind of verification would be those self-fit over-the-counter hearing aids would be kind of the safest bet of like saying, yep, I know the FDA has looked at this. I know they've met standards. That is, for right now, kind of the safest option if you just don't know where to kind of start with the over-the-counter.
May I change the subject just a little bit? By elimination, I assume that tinnitus is not a cause of hearing loss.
Yeah, we think of it the other way around. Generally, hearing loss is the driver for sounds in terms of tinnitus or tinnitus, yeah.
I didn't follow that. Could you do that again for me?
Yeah, so generally, it's the underlying hearing loss that's leading to the ringing or the tinnitus. In that when the hearing has changed and the ear is no longer sending the same signals to the brain is then making up sound. So ringing and things are coming from the brain, not from the ear. And so things like amplification, giving sound back to the ear, back to the brain, for many people can help their ringing. So ringing I think of much more as a symptom than the cause.
Well, is there any research being done on that?
On tinnitus? That is definitely one of the understudied areas within ENT. There are a lot of strategies that we have, including things like amplification and masking. But it is an area that we have some answers to, but certainly not enough.
I'd like to say something about the Costco. And first, I'd like to say I don't own any stock in Costco. So I'd like to say what my experience is. And it seems to be between an audiologist and over the counter.
Yes.
Because they have people there who are very helpful, but they call them audio technicians.
Yeah.
They also give a 1-hour free hearing test. And the printout of my test was exactly the same as I had gotten from an audiologist in a doctor's office. They're also available for help
Yep.
over the phone or as drop-in. So I think they're somewhere in between.
I guess.
You don't just buy it over the counter and leave and they say goodbye.
Yeah, exactly. Yeah. And that's why I do regularly recommend them. Some Costco's do have some audiologists who are doctorate level trained individuals. But then there's something in terms of hearing instrument specialist or hearing aid dispensers that kind of feel it's usually like an associate level degree or things like that. So it's a different level of degree, but like you said, they are trained individuals for sure. And that's exactly why I do always talk about Costco with any of my patients, because I never want cost to be the reason you don't do something. And they do follow best practices. I know obviously not everybody's always 100% happy, but it is an option if the price tag that you're seeing at your audiologist is just too high. There are other options out there to get assistance, for sure. That's great, thank you.
One of the worst place to, even with a hearing aid, is a restaurant.
Yes.
Is there anything new about this voice to noise ratio?
Yeah. So that is exactly where we struggle most in terms of that by far is the hardest listening setting. There's obviously a lot of technology that tries to go into hearing aids to address that in terms of the sound processing, the terms of directional microphones. The biggest help, while not perfect, is thinking about a remote microphone. So a device that connects to your hearing aid. The hearing aid, has all the microphones at the level of here. And so we're asking a lot of those microphones in order to be able to pick up all the different things and to differentiate what you want to hear versus what you don't want to hear. So a remote microphone takes that microphone in terms of picking up the sound and it moves it closer to the thing that you want to hear. So again, not perfect, but those are some of the types of things that can be helpful in terms of just basic things to try. But it is for sure like the holy grail of like being able to hear in noise is the pursuit of many people. So they're always working on the algorithms for sure, but at least in the meantime, things like a remote microphone can be helpful, but it is by far the hardest thing that we all struggle with.
I've been hard of hearing since I was 5, and so a lot of my friends, before I moved down here, always came to me and said, where do I go to get tested?
Yeah.
I think I may be hard of hearing,
Yeah.
and I try to encourage them, if they do find they are, to get a hearing aid as soon as possible, and don't wait until you're too far gone. And I found that's the most helpful.
Yeah.
And in response to the issue of hearing in restaurants, I had a set of Nieman hearing aids that I absolutely adored. But I think that was before they came out with all the fancy stuff. Button on your
Nice.
hearing aid,
Nice.
and it literally knocked out everything in the back.
That's great.
And you could enjoy your conversation,
That's great.
but you can't do that now with all the fancy hearing aids.
Yeah, they are quite fancy. And I think exactly that, yeah. And I will say in terms of the timing of when to get hearing aids, we know on average that people wait about 7 to 9 years between when they feel like they start to have changes to then actually getting hearing aids. So that's on average. So you're not alone if you have been delaying things. I think the thing that has been missing is that traditionally, in terms of this hearing space, we've not always done a great job of doing high quality research. That is something that our team and many others are very much trying to change. And so things like even the Achieve trial of being able to point to something to say, this is why you need to do something about your hearing. We haven't traditionally had that, of something to say that this is the evidence that supports why you should do something earlier. We generally think it matters to do something about your hearing earlier, but we don't have a lot of high quality research to say exactly why it matters. So a lot to kind of come in terms of seeing, are there hardcore good research to point to say why it may matter to do something about your hearing loss beyond just kind of what we see in field clinically.
Okay, thank you, Dr. Nieman.